They're essential to our lives. Yes, we're talking about our eyes, and we need to keep them as healthy as possible. So let's welcome Dr. Mansoor Mughal. He's a retina specialist with Retina Associates PA. Welcome to the show.
Thank you so much. It's a pleasure to be here.
Okay, so in this community, we've seen Retina Associates PA grow. I've been here since 1988, and you've seen a lot. That experience matters when it comes to our eyes, of course. Tell us, you see all kinds of things. What is the most common emergency you see?
Sure. So we see a whole range of emergencies. The ones that provoke the most anxiety in patients are retinal detachments and very often infections in the eye, which occur after cataract surgery, for example, or from intravitreal injections given in the course of retinal treatment. And this can be extremely anxiety-provoking for patients because they suddenly lose their vision and they want an immediate diagnosis and the reassurance that somebody is there that can take care of their problem.
Right. I'd want a doctor that's very soothing, so it looks like you calm them down, and it's normal. That's a lot. That's high stress, but you know what to say and what to do. That's important. So what are some of those treatment options?
Absolutely. So we run through the diagnosis, exactly what is the problem, what type of detachment it is, whether it's something that we can repair within the office or whether we need to take the patient to the operating room in order to facilitate repair. And then at all times basically keeping the patient informed as to what their choices are. And that keeps the anxiety level down. However, patients are understandably concerned until we can go ahead and repair the retina. Okay,
and then you also have, so if you come in there, you want a doctor that has knowledge about different things you can do. What are some of the different treatment options? Are there options available?
There are, definitely. And so for certain types of retinal detachment, we can use an in-office procedure where we numb the eye. We can use we can use freezing treatment, and then some gas, which we can inject in the eye. Often after that, the patients need to position in a face-down position for about at least 24 hours. And then we can see if that's, if that works, and if not, then we can take the definitive step and take them to the operating room. However, there's some retinal detachments that present that really are best served by being repaired in the operating room from the get-go. And when we actually do those repairs, there's a range of techniques we can use depending on the complexity. We can use short-acting gas, we can use long-acting gas, and we can also use a substance such as silicone oil.
Okay, it sounds like you have lots of different options and it's a very personalized approach, correct?
Absolutely. So no one case is the same, and we try and individualize our approach to the patient, and we try to minimize we try to minimize any kind of inconvenience to the patient while securing a good visual outcome for them.
And Retina Associates PA, you say that you want to help the First Coast see better, and literally not just a slogan to you. So based on your experience, and shout out to your school, Cambridge, all that schooling helps. Although my daughter went to Oxford, I won't hold it against you. So why should the patient, this is important to me, can we trust you?
Absolutely. We have decades of experience. This is all that we do, day in, day out. We use the latest diagnostic equipment. We use essentially the latest surgical techniques. We keep ourselves up to date, and all our patients can rest assured that we will do the very best that we possibly can for their visual outcome.
All right. Thank you, doctor, so much for being with us on First Coast Living.
Very welcome.
And of course, you can head to our website for much more on this. All right, and that's firstcoastliving.net.